Charley horses during pregnancy. This is one of the most requested videos that I have because it is one of the most annoying and it just seems like useless parts of pregnancy. So today we're going to talk about what Charley horses are, how to prevent them, and what to do when they strike, especially in the middle of the night. It's so unfair. So this video comes from a post that's on my website. And when I was using AI to make a picture to accompany this post, I asked AI to make the devil coming out of your calf because they are the absolute worst. I swear, just as you get to like a good place in sleep, all of a sudden your calf just like bunches up and you're like, what the heck? That's what a Charley horse is. It's basically just a leg cramp. Now, Charley horses can actually happen anywhere on your body, but they happen most frequently in your calf. But if they're happening on other areas of your body, it might be the same thing. However, if you're having big pains like this, or some people feel like a Charley horse here on their abdomen, be sure and let your provider know. I know that some people actually feel like ligament pains are Charley horses in their abdomen, and they do have some things that are similar. Okay, so what can we do to prevent them? The first one is to stretch. Now, I'm a huge fan of prenatal yoga, but making sure that you still even look at your calves. I know you're like, oh, my hips are the absolute worst, but you still got to be stretching out your calves. And honestly, I think anytime that you do your pelvic floor and anything along your legs, that is a big win. So making sure that you're adding stretching to your daily routine can be a big win in the Charley horse area. Now, of course, not all of these things will entirely prevent them, but they can lessen them or make them less frequent. I gotta ask, do you guys get Charley horses? Like, how frequently are you getting them? Tell me down in the comments. Okay, the next one is to remain active. Now, I know it is tempting to turn into a potato when you are pregnant because you're so tired. But if you can just add a quick after dinner walk, I'm not talking about miles here, just a walk around your neighborhood or something like that using good shoes, it can really help your body manage things like Charley horses a little bit better. So making sure that you're adding a little activity, but also getting your rest in. The next one is calcium, potassium, and sodium. These are really important electrolytes that your body needs to make muscle contractions. And so I want to always make sure that your body has enough of these things. Now, sodium, not so much of an issue because we all love to shake a little salt onto our things. But if you're looking to increase potassium, you might want to add something like a banana to your daily routine or every other day. You don't have to eat it daily. And with calcium, Tums has a lot of calcium in it as well. So when I had heartburn issues, I was actually helping my body refresh their calcium stores as well. Now, I know a lot of people love to get into electrolytes lately, but I want to caution you that most people actually don't need electrolytes. In fact, most people probably don't need calcium, potassium, or sodium added to their diet. Usually we're getting plenty of those things. And a lot of those electrolyte packets may have too much sodium, added sugar, added food dyes, other things that can actually end up being problematic. So for me, I drink filtered tap water through my fridge or a filter in my home. You don't want to drink distilled water because that can actually take these types of things out of it, but making sure that you're drinking enough water, keeping a varied diet. Usually you don't need those added electrolyte drinks. However, if you're working out, you're super sweaty, something like that, you might want to add an electrolyte drink in. Talk with your provider if you have any questions on this. I just think that electrolytes are being pushed hard in a lot of places that I'm looking, and I want to make sure that you have the full picture on that. It's also important to know that they aren't regulated at all. So they could say that they only had a little bit of sodium in it, but it may have much more. So something to keep an eye on. Pro tip, did you know that too much sodium in your diet can be a problem for hypertension and preeclampsia for some people, although the studies are still out, but I want to make sure that you're not adding a lot of extra sodium to your diet because of that. As a note, if I work out really hard, a lot of times I'll do an electrolyte drink. I have a few of the packets at home just because I want like a little sweet treat after I work out so hard. So that's okay. Just realizing that it's a treat rather than like my body needs these electrolytes daily. Again, talk with your provider. It may be something that you need. The next one, which we sort of talked about, is hydration, making sure that you're getting enough fluids in. Now, you want the majority of your fluids to be water, but other things can be used in addition to water. Things like juice, Gatorade, if that's what you want to do, things like that. Talk with your provider if you have any questions about the drinks that you are drinking. I actually link to my post on what drinks are best for pregnant women. I'm going to link that one down below. As a note, there is no professional body that recommends any amount of alcohol during pregnancy, so definitely avoid that one. Hydration is so important in pregnancy. And I hear a lot of people that are like, oh, you need 12 giant glasses of water a day. And for me, that was a little bit too vague. Hilary wants, to know exactly how much we need. But the good news is your body has a built-in system that's going to tell you how hydrated you are if you have a white toilet. And that is how tinted your urine is. You want to look for a very pale color of yellow. If your urine is looking more yellow or even a dark yellow, that is a sign that you are not drinking enough and you need to drink more. So if you're looking for a magic number of like how many glasses you should drink a day, also glasses really depends. There's lots of different sizes of glasses. You don't need to. You just need to look at your urine in the toilet as long as, again, it is a white toilet. This is harder to tell on those fancy tinted toilets like I had in the 70s. But that is the easiest way to stay on track of if you are hydrated or not. And if you're like, Hilary, that's an amazing tip. If you're looking for more tips for third trimester, labor, birth, postpartum time, I have a birth class that I recommend that has other awesome tips. I'm going to put the link down below. And while we're here talking about your movement and hydration, I also want to make sure that you're doing kick counts if you are in your third trimester. Make sure that you are doing them correctly because I'm seeing a lot of providers who are not teaching the most recent evidence-based way to do kick counts. I actually have a cheat sheet that I'm going to link down below for you. It's totally free. Okay, the next one that I see a lot and is sort of new to the scene is magnesium. Now, sometimes people would do Epsom salt baths, which is part magnesium. That's what Epsom salts is. But a lot of people are taking a magnesium oral supplement in addition to a varied diet. And in fact, as I am heading into perimenopause, am taking a magnesium supplement as well. And I have found it to be very helpful. For me, I feel like it's helped chill me out a little bit and my sleep is a little bit better as well. But they're not right for everybody. You need to talk with your provider about what kind they recommend. There are several kinds of magnesium, and some of them may make you have the runs. And you want to talk to them about what dosage would be appropriate for you. So make sure you're talking with your provider. This is something you could probably call into the office and see what they recommend, or at your next appointment, bringing it up with your provider so that you're getting what's right for you. The next one, which a lot of you are absolutely going to hate that I'm saying, is you may need to change out your shoes for the duration of your pregnancy. If you are having calf cramps, it may well be from wearing heels or shoes that just are not supporting your body the way you need during pregnancy. So switching out to more comfortable shoes is something that you might need to do during pregnancy. But I am here to tell you that I had calf cramps very frequently in pregnancy, but they went away after the baby was born. So just because you're pushing those heels to the side right now doesn't mean that they are going to have to go away entirely now that you are a new mom. Hopefully they'll come back and you'll be able to enjoy them again if you enjoy them at all. I sort of slid them to the side and kind of left them there. I found out that I was happier in comfortable shoes, so that might end up being you as well, but they will come back if you are interested in them. And the last one, which makes us all feel like a grandma, is compression socks. Now, compression socks put a little bit of pressure. You can actually decide how much pressure you want. There's kind of like small, medium, extra compression. And it helps all of the fluid go back up to our body. It can help reduce swelling, which can ultimately decrease these types of Charley horses during pregnancy. If you are having Charley horses frequently, I would definitely recommend compression socks. The good news is there are a lot of companies making them and they look like regular socks. You aren't going to have the nasty white socks that we used to put on our grandparents back in the day. So there's a lot of cute socks. I've bought them at Target. There's places you can look around and find compression socks that you will like. I think Bombas even has compression socks. So look around, find some that look cute to you. As a labor and delivery nurse, I wore compression socks at work just because I was on my feet so much. I was not pregnant, but they can really help any of that lower body leg pain. It's definitely worth it to get a pair and see if they work for you. Okay, so we've talked about prevention, but what do you do if you get that horrible from the devil leg cramp? The first thing to do is to make sure that you flex your foot. Do not point it. So we're not looking to point it like a ballerina. You immediately want to flex. Do not point. Now, for a lot of people, they're like, I can't. Like that muscle cramps up so much, you cannot bring it up. And if that is the case, you're going to want to try and get onto the floor and use the floor to help flex that foot back up and help stretch out your calf. Now, after that, it might just go away and you're good to go. You can get back in your bed and go to sleep. However, for a lot of people, I would recommend walking around for a little bit, try and use that muscle And then some people actually want to apply heat or an ice pack. I always recommend a microwavable heat pack because it will cool with time and hopefully you can get some more good rest once you put that heat pack on. Some people prefer ice, and I think you can go either way. I prefer heat. I think my muscle relaxes better that way, but that's something to think about. I know a lot of people worry that they've like hurt their leg because that contraction, while it goes away, like you don't feel that strong Charley horse cramp, you still feel a lot of pain in your leg, and it isn't unusual. I think it's your muscle just reacting to contracting so strongly and maybe the buildup of lactic acid. Hey, Editor Hilary here. I just realized that you can actually have blood clots in your calf as well. So if you have a cramping pain in your calf and it is not going away, often accompanied by redness, tenderness if you push on it, heat, that's something you need to get checked out with your provider. So if the pain is continuing, it's not just like that searing pain and then it goes away. If it's continuing, tell your provider. And if you're having frequent calf cramps, talk with your provider because we just want to make sure that a blood clot is not the issue, and it's pretty easy to check out. Now, here is the most valuable piece of information in this video is that you can absolutely hate being pregnant and hate the side effects like this. Nobody loves getting a Charley horse in the night, and they are more prevalent during pregnancy. And you can still be so excited for this baby and absolutely love your baby. I know for a long time, I didn't think that I could hold both of those things at the same time, but you absolutely can. I'm here to tell you that there are a lot of very annoying and horrible things about pregnancy, and you hating them, there's no problem with that. It's fine to absolutely hate it and still absolutely love that you are going to have a baby at your house soon. Both of those things, totally fine. Now, like I talked about before, sometimes people feel like they get Charley horses on their abdomen. Usually it's ligament pain. So I have a whole video about that I'm going to link to right here. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared for your upcoming birth, and honestly, all the weird stuff that comes along with all of it.